And so I guess the best way to say this is we all kind of, in all of these rare diseases, I've mentioned a bunch of rare epilepsies, I've mentioned ALS, and there's other adult neurodegenerative diseases that are rare that you can look at. We all kind of need the same thing. We need to follow the patients from the beginning. We need to follow them across time and get certain information. And then we need to know the intervention points as they go along. And in many cases, the interventions are actually the same thing. I mean, I don't know how many disease groups that I've spoken to that are like, hey, we're trying mTOR inhibitors, to prevent the evolution of our disease or to stop the symptoms. And I'm like, oh my gosh, mTOR inhibitors, cancer, epilepsy, right? Other disease states. It's like, so a lot of times it's the same medicines and things that are being targeted. So we take a really holistic approach to this, that a lot of research that's happening in other rare diseases is really helpful to us, specifically in LGS. We have our specific piece that's carved out. We're not competing with anybody. There's just way too much work to do. And the data that they're collecting, I also need that. I need that data. And because other disease states are, if I could get access to their data, which is also locked behind silos, it would help me to understand my disease state better and help get that information to researchers so they'd have a bigger pool of knowledge to pull from. And so I just feel really strongly that it's not okay to just have an LGS registry / natural history study. We need a rare disease registry natural history study where we have access to that data as a whole. So across these disease states, we could be learning from each other and applying, and everything is just so siloed right now. And this data is just so overlapping that we're really doing ourselves a disservice. If we could aggregate that in some way, bring it together, I think we would go so much further, faster.